healthcare should not be run for profit. It should be run for the people of this country to provide care based on.
My question to you is, why are you standing up for healthcare today?
Well, there's a definite need. There's down the road we're going to be in big trouble if something isn't done.
I'm a family doctor. I work in an inner city clinic in Saskatoon, and I see patients largely low income, dealing with lots of struggles related to their social circumstances and their health. And it's work that I love. I love that somebody can come and see me when they need to see me, not when they can afford to see me.
Okay, Irene, so why are you standing up for healthcare today?
Because of my age, and I'm retired, and I need the coverage. I've had 2 hip replacements, and my health isn't that good, so I really need my coverage to stay as it is.
Well, with the age that I'm at right now, I know I'm going to need it down the road. I've already used it, and it's still there now, and I want that to remain there.
I think the cutting of the training periods for doctors, plus the wait times in the hospitals, is getting ridiculous.
It's not about what political party one belongs to. It's about our nation standing at a crossroads. It's about what choices we're making for the future of our country, for our children, for our grandchildren, for our parents and our grandparents.
But I'm just afraid of what Harper's going to be doing here with the health care. And I says, you know, I have a lot of young families still, right, and I'm sure they're going to need that down the road.
Harper has broken with even the tradition of conservatives for the last century, frankly. Well, at least since the war, since World War II. He's broken the fundamental social contract that we have in this country, I believe, in a number of ways.
I think it's going to be our hospital stays, and I think it's also going to be our prescriptions and medical coverage. It's just not going to be there for us, and as we're getting older, we need it now.
Personal costs are going to go up. The personal costs. If you're not covered by some kind of benefit health plan, you're going to pay through the nose. OHIP only covers certain things for a protracted period of time. Like physical therapy, you're only good for 5 or 6 weeks. Doesn't do you much good when you need it for 3 or 4 months, or like a long term. You end up paying out of your own pocket. They keep on saying they're improving things, but all they're doing is cutting back and making things more difficult than it really has to be.
Canadians need to know that these things are being affected, that these are the choices that we're making this election.
We are the only country with universal health care that doesn't have drug coverage. This doesn't make any sense. 1 in 5 Canadians don't fill their prescriptions, necessary prescriptions, because they can't afford to. And that costs us all. That costs way more in long-term results because they get sicker. They show up in the hospital. They show up needing surgeries because they didn't take their medications in the first place because they couldn't afford it. It's no way to save money.
And so in 2004, they negotiated a health accord with the provinces. And it set a funding formula that restored the federal share. Today in Ontario, the federal government provides about 23 cents for every dollar of health care that's spent. So it's moved up significantly over the last decade. Stephen Harper refused to meet with the provinces when that accord came to an end in 2014. He's refused to meet with them since. Instead, what he announced was that he was going to begin a new funding formula for health care. That if you compare it to what the funding formula was that was set out in the accord, would cut $36 billion from our health care funding over the next 10 years across the country.
The coverage isn't as good as it was, and I hope it doesn't go any lower.
So something like a $36 billion cut, you could see there's going to be a great effect.
Whoa, I didn't know that.
$36 billion cut.
Yeah.
What do you think about that then?
Not good. Not good.
Not a good cut.
No. I don't know where he's going to leave us, retirees, when they do something like that. I mean, there's a lot of us, and we need this coverage. And when they start cutting, we're going to be hurting.
Will you demand that the cut be stopped? Will you participate? Will you tell your neighbors about this? Will you participate in building a movement that cannot be ignored, that will affect all political parties, that will make sure that every political party promises to protect public health care for all and changes this course. We can, all of us, take a role in preserving public Medicare for the next generation. I'm going to end with a quote, let's be inspired by the father of public Medicare in this country, Tommy Douglas, who said at a time when there was a threat of extra billing like we're seeing now in Canada, he said, I'm telling you that unless those of you who believe in Medicare raise our voices in no uncertain terms, unless we arouse our neighbors and our friends and our communities, we are sounding the death knell of Medicare in this country. And I, for one, will not sit idly by and let that happen. Thank you.
I know I have a couple of young grandkids right now. And like, I just hope these benefits are around, that's all, for them. Like, you know, we've been fortunate because we fought for them over the years, and what we have today we don't want to lose. I want to make sure that it's ensured that our young fellows, our young kids today, have the same benefits that I have today.
Our kids are running into trouble, you know, waiting a long time for MRIs with problems that they have. That there really should be no reason for that.
The government's not going. They're not going in the right direction with healthcare. They're going backwards.
Will you be voting this